First, we will take consent history of the patient and tell him about what you are going to do with him. Then we will ask him about if he or she is having any systemic disease or ocular disease in the previous history. So it will help us in better diagnosis of the disease. Then we will do corneal Hirschberg of the patient, in which we can find out first Purkinje images. So we will calculate the deviation if he or she is having any phorias or not. On the second step, we will calculate the VA of the patient in distance, near and do pinhole of both eye monocularly. First, we will do distance VA of the patient. This patient is reporting 6/9 in distance vision. Now we will do pinhole of the patient. We will show him light that he can see through a dot in it. The patient is reporting 6/6 through the pinhole. We are doing both eyes one by one. Now we will do near vision of the patient one by one monocularly. The patient is reporting N6, but we will assume for the correction that he is giving N8. After that, we will do cover and uncover test of the patient about the deviation he or she is having in distance vision and near vision both. In this, we will block one eye and uncover another eye. Step by step, you can see in the video that patient is seeing in distance and near target. Medoxing it is helpful for finding near phoria. It helps us to find iso, exo and hyperphoria or cyclo deviation in near conditions or near working. This patient is having exophoria in near vision, just of 2 diopters. Other phorias are normal. Medox rod is an instrument in which we can find distance phoria. We will block one eye with Medox rod, vertical and horizontal, one by one to find out any kind of phoria like iso, exo or hypo in the patient's eye. We can find both eyes at a one time. It is done at distance of 3 meters. Extraocular muscles. Extraocular muscles are checked by 9 gazes. Both are done binocularly. Both eyes are done binocularly, and we will find if any muscle is suppressed or overaction. In overaction, so we can detect through this event. Now we will do vigilance of the patient and told him to see pen target and told tell us about where it is going to blur. Retinoscopy, it is done through the retinoscope. We can take a distance target for the patient and we will sit at 1.5 diopter distance, or we can call 67 centimeter, and we can find out if patient is having with the movement or against the movement. So we will neutral that point through the help of lenses in the trial box. Right eye is neutralized by 1.25 and the left eye is neutralized by 1.50. Now we are doing BVS of the patient. BVS means best vision sphere. The technique we are doing is maximum plus minimum minus. We will add half of the retinal number to it.
So I sneak out to the garden to see you. We keep quiet cause we're dead if they knew. So close your eyes. Escape this town for a little while. Cause you were Romeo, I was a scarlet letter in my
Now we will do diagram of the patient one by one of both eye. We will tell patient to tell us about the sharpest plus he is achieving from red or green. JCC, it is helpful for finding out cylinder number of a patient. In this, we do 3 steps if a patient is needed or not. Secondly, we will align the axis. Third, we will do power alignment, and fourth one, the transposition of the JCC through BVS. This patient is achieving minus zero point 0.5 from the JCC on 100 axis. So we will align it with the axis of the patient and give zero point 0.5 J cell to the patient. Near addition, it is done usually in near from 35 to 60 year people. It is done for the correction of near vision, and it is done after the distance vision. We are doing this in this patient for demonstration purpose. Normally this patient didn't need any kind of addition, but we are showing that it is done molecularly one by one both eyes.
We were both young when I first saw you. I close my eyes and the flashback starts. I'm standing there.
You can see it is a RF ruler. In RF ruler we can find a convergence and accommodation of a patient, and we can also calculate the age of the patient. We will give target of point and alphabets to the patient. IPD, it is a measurement of intrapupil distance of both eyes, and it is helpful in decentration and centration of the glasses. This patient IPD is 64 mm in distance. PVD is called backvertex distance from glass to the cornea of the patient. It is done through synoptic slit. There are many ways to find out its value, but we are using synoptic slit after closing the eye of the patient, so we can calculate the BVD. It is done with more than 4 diopter patients, not less than 4 diopter. After putting synoptic slit, We cross a paper into it and calculate the length of the paper touching to the lashes of the patient.
So I sneak out to the garden to see you. We keep quiet cause we're dead if they knew. So close your eyes, escape this town for a little while.